This video is intended for educational purposes and is not intended as medical advice. If you have any questions about your health or medical condition, please contact your healthcare provider. Welcome to our session today. It's called What is Blood Pressure? My name is Sarah Stolzenberg. I'm a registered nurse and a SASH wellness nurse. Today, we're going to talk about blood pressure, how to manage high blood pressure, and the resources available to you through the SASH program and your community to help you maintain a healthy blood pressure. According to the American Heart Association, nearly half of adults have high blood pressure, and many don't even know they have it. We know that your blood pressure increases as you age, and so for older adults, it is very important to understand this topic. What is blood pressure? Blood pressure is the force of blood against the inner walls of your arteries. It is the measure of how hard your heart must pump to deliver blood throughout your body. High blood pressure is a common condition in which the long-term force of the blood against your artery walls is high enough that it may eventually cause health problems. Complications caused by uncontrolled high blood pressure include heart attack and stroke, aneurysm, which is a rupture in the blood vessel, heart failure, kidney issues, eye issues, metabolic syndrome, dementia, including changes in your memory and thinking. The factors that put you more at risk for developing high blood pressure are age. The risk of high blood pressure increases as you age. Until about age 64, high blood pressure is more common in men. Women are more likely to develop high blood pressure after 65. All people, though, are at more risk of high blood pressure as they age. Another risk factor is race. High blood pressure is particularly common among people of African heritage. Family history is also a risk factor. Being overweight, not being physically active, using tobacco, smoking or chewing tobacco can cause short-term and long-term high blood pressure. Using too much salt. When you have too much salt or sodium in your body, that causes your body to hold or retain fluid. And that can then create more volume in the blood vessels and put more pressure on them, causing higher blood pressure. Too little potassium. So potassium and sodium have a kind of a balancing effect on each other. And when you have too little potassium, you have too much sodium a lot of times. And again, too much sodium can create higher blood pressure in the body. Drinking too much alcohol can damage your heart, and that's another risk factor for high blood pressure. And then stress. High levels of stress can lead to a temporary increase in blood pressure. Also, stress-related habits such as eating more, using tobacco or drinking alcohol to manage stress can lead to further increase in blood pressure. And also, certain chronic conditions are risk factors for high blood pressure, including kidney disease, diabetes, and sleep apnea. So why blood pressure increases as you age? Your heart begins to work less effectively. Degeneration of the heart muscle cells and thicker cell walls can slow down the time the heart takes to fill with blood, increasing the pressure on the vessels. As we age, our arteries tend to narrow and harden, causing clogged arteries, potentially causing strokes and heart attacks. The ability to process dietary salt also decreases with age. And again, when we have too much salt or sodium in the body, that creates higher blood pressure. Decreased kidney function can cause high blood pressure. When the kidneys are damaged or cannot filter blood as well as healthy kidneys, they create excess fluid and waste that can build up in the body and cause higher blood pressure. Blood pressure readings. The only way to know if you have high blood pressure is to have your blood pressure checked. So understanding your numbers is key to controlling high blood pressure. So the top number of a blood pressure reading is called the systolic blood pressure. And this is actually the pressure against the blood vessel walls when the heart contracts or beats. The bottom number, or the diastolic blood pressure, is the pressure against the blood vessel walls when the heart is at rest. Typically, more attention is given to the top number, or the systolic blood pressure, as a major risk factor for cardiovascular disease for people over 50. But if either is elevated, you can have a diagnosis of high blood pressure. Normal blood pressure for the average person is under 120/80. Healthy normal blood pressure for people over 65 and older is under 130/80. Blood pressure categories. These are the 5 blood pressure ranges as recognized by the American Heart Association. This helps guide people and healthcare providers in how to address and treat high blood pressure. So you see the green category up there is normal. We just talked about that. That's a blood pressure of less than 120 for the systolic and less than 80 for the diastolic. If you have this blood pressure, really, it's just about sticking with heart healthy habits, like following a balanced diet and getting regular exercise. The next category is elevated, or the yellow one, and that is 120/129 and less than 80. People who have this blood pressure are likely to develop high blood pressure unless steps are taken to control the condition. So things like lifestyle changes are really important for this group. The next stage is the orange one down, hypertension stage 1. And this is when blood pressure is consistently between 130 and 139 for the systolic, or 80/89 for diastolic. At this stage, doctors are likely to prescribe lifestyle changes and may consider adding a blood pressure medication. The next one down is hypertension stage 2, that lighter red. And this is when the blood pressure consistently ranges at 140/90 or higher. At this stage, healthcare providers are likely to prescribe a combination of blood pressure medications and lifestyle changes. The last category down is a hypertensive crisis. And this is the stage where high blood pressure requires medical attention. If your blood pressure readings exceed 180/120, wait 5 minutes and then test again. If your readings are still unusually high, contact your doctor immediately. If you're experiencing any symptoms, chest pain, shortness of breath, back pain, numbness, weakness, change in vision, please call 911. When should I check my blood pressure? So even if you have normal blood pressure, again, 120/80 or under, it's still important to be checking your blood pressure because, as we said, as you age, your blood pressure increases. So the recommendation for having even normal blood pressure is still to check once a month, just so that you're monitoring it to make sure there are no changes or it is not increasing. For people with heart disease, diabetes, kidney disease, history of stroke or heart attack, we recommend they check every week or every other week because they are at higher risk for developing high blood pressure. If you are just starting a blood pressure medication or are changing a blood pressure medication, we recommend checking daily for 1 to 2 weeks. If you feel any symptoms like dizziness, lightheadedness, headache, very stressed out, you can always check your blood pressure just to make sure it's okay. It's great to have a blood pressure cuff at home to monitor your blood pressure. We do not recommend the wrist or finger machine because they are proven not to be as accurate as the arm cuff. So we recommend the electronic arm cuff for home monitoring. SASH is another good resource to help check your blood pressures, the SASH wellness nurse. and sometimes the coordinator can check your blood pressure. There are usually blood pressure clinics held on site at your building. Please check with your SASH team to see if that's offered at your site. Blood pressure tracking. This is also an important tool to help you get a sense of where your blood pressure is at. The SASH program has a great handout that you can get from your SASH wellness nurse or coordinator, and use this form to track your blood pressure, whether it be even just once a month you're checking, every week, or daily. It can be a good resource for you and your nurse, and also for your healthcare provider to see what your blood pressures are over a longer period of time. I have worked with a number of participants and their healthcare providers to try to help manage their blood pressure this way. And we check weekly, and then I give those readings to the healthcare provider, and they have a great sense of what the treatment plan should be for that participant based on this tracking sheet. You'll also notice on the tracking sheet, it talks about your blood pressure goal. Every individual is different based on risk factors and other things. And so it's a really good idea to talk to your healthcare provider about what your blood pressure goal should be, what that range is that is the best for you. Ways to lower blood pressure: maintain a healthy weight, exercise regularly, and the recommendation for exercising is that 30 minutes a day, 5 days a week, getting your breath rate up. And that is going to help keep that cardiovascular system in your body healthy. A healthy diet. The diet that's recommended to help manage blood pressure is called the DASH diet. That stands for Dietary Approaches to Stop Hypertension. This diet includes foods that are rich in potassium, calcium, and magnesium. These nutrients help control blood pressure. The DASH diet is rich in vegetables, fruits, and whole grains. This diet limits foods that are high in sodium, saturated fat, and added sugars. The standard DASH diet limits sodium or salt to 2,300 milligrams a day, which is equivalent to about 1 teaspoon. Studies have shown that the DASH diet can lower blood pressure in as little as 2 weeks. Moving down the list, reduce sodium. So we talked about the DASH diet and it's limiting sodium. Reducing sodium is one of the most important ways to lower blood pressure. Limiting alcohol, quitting smoking, decreasing caffeine, reducing stress, monitoring your blood pressure at home and consulting with your healthcare provider regularly, and also getting support to help you manage it in whatever way is best for you. Sodium and food labels. A lot of times people don't know how much sodium or salt is in the food they're eating, especially when they're shopping at the grocery store and there's a lot of canned goods, packaged goods, frozen dinners, microwave dinners that people are getting. Those are usually the high salt foods. So I wanted to talk briefly about how to identify how much sodium is in the foods that you are buying. So it's important to be able to turn the package around and read the food label. With the DASH diet, I talked about a limit of 2,300 milligrams a day. There's also a lower sodium DASH diet where you limit the sodium to 1,500 milligrams a day. The 2,300 milligrams a day is probably a good place to start, but always check with your doctor. So when we look at these two food labels, one is comparing them. One is a low sodium canned diced tomatoes, and the other one is just a regular canned diced tomatoes. So the first thing you want to do is look at that red circled area. That's the sodium. On the low sodium tomatoes, it's 10 milligrams. And on the regular canned diced tomatoes, it's 150 milligrams. The next thing you want to look at is the serving size. The serving size is a half cup. The servings per container is 3.5. So if you just have a half cup of the low sodium tomatoes, you would have 10 milligrams of sodium in that amount of tomatoes. For the regular diced tomatoes, you had a half cup, it'd be 150. It's a lot more. But if you eat the whole can of tomatoes, that's 3.5 servings. So you'd have to multiply those levels of sodium by 3.5. So if you had the low sodium canned tomatoes, you'd have 10 milligrams times 3.5, which is 35 milligrams in the whole can. And in the regular canned diced tomatoes, you'd multiply 150 times 3.5, and that would be 525 milligrams of sodium. So it's clear that the regular canned tomatoes have a lot more sodium in them, but it's also more important to make sure you're aware of how much you're getting in each product. Then you can really know and limit and watch the sodium you're eating. I would recommend not eating a meal higher in sodium than 600 to 700 milligrams. How SASH can help. So SASH can offer a lot of resources to help you manage your blood pressure. First of all, you can ask your SASH wellness nurse and coordinator to check your blood pressure and help probably the SASH nurse to help with tracking as well. There should be on-site blood pressure clinics at your building. The SASH program also has a cuff loaner program, so we can loan you a blood pressure cuff for home use, especially if you're just starting a blood pressure medication or have a change in medication, or if your blood pressures are running a little high and you want to check more often, we're happy to lend you a home cuff. SASH also offers many health education programs and classes, from blood pressure programs to nutrition, diet classes, to exercise programs. Please check your site to see what's offered. There's many things available. Your SASH team can also help connect you to other resources. For participants in Vermont, there is the My Healthy Vermont program that offers workshops statewide, and currently they are offering high blood pressure management. For participants in other states, please see your wellness nurse or SASH coordinator. And SASH staff and teams can help support you to set healthy goals around blood pressure and help you to achieve those goals. So that is the end of our session today. Thank you so much for joining and listening. If you have any other questions, please see your SASH coordinator or wellness nurse.